Hey, Dr. Yates here. We often think of medications as purely additive, so adding a chemical to help manage a symptom or condition. However, many common prescriptions can act as nutrient thieves, blocking the absorption or increasing the excretion of vital vitamins and minerals. So when these levels drop, you might experience new side effects that are actually just signs of deficiency. Maintaining these levels is critical for your energy, immunity, long-term vitality. So here are 10 of the most common nutrient depleting medications. So let's get into it, starting with metformin. This is for diabetes and it depletes vitamin B12, vitamin B6, and folate. Note that low B12 can lead to fatigue, numbness in hands or feet, and I've also seen it cause issues with dry eyes and muscle pain. Proton pump inhibitors is next. These are PPIs. These are for acid reflux and GERD. They can deplete magnesium, calcium, and vitamin B12. Low magnesium can cause muscle cramps, anxiety, and heart palpitations. Then we have statins. Statin medications are for high cholesterol. They can deplete coenzyme Q10 and vitamin D. CoQ10 is essential for muscle health and energy, and depletion of CoQ10 can cause muscle aches. This is a very common side effect of statins. Oral contraceptives or birth control, these deplete folate, magnesium, vitamin B6, and zinc. B6 depletion is a common culprit behind the mood swings and pill-induced blues from birth control pills. Then you have ACE inhibitors. These are for high blood pressure. They can deplete zinc, magnesium. Zinc is vital for your immune system and for wound healing. The next medication we have are loop diuretics. So these diuretics are for high blood pressure or edema. They deplete potassium, magnesium, B1, calcium. B1 deficiency can impact your heart function and your mental clarity. Then we have corticosteroids. Lots of side effects for those. Inflammation, asthma, arthritis is what they're used for, and they can deplete calcium, vitamin D, potassium, magnesium. So a long-term use of these can significantly impact your bone density due to calcium and vitamin D loss. Then we have antibiotics, which are used for infections. These deplete B vitamins, vitamin K, and your healthy gut flora. Broad spectrum use of the antibiotics can wipe out your good bacteria that synthesize a lot of these vitamins. We then have to move on to SSRIs. SSRIs are for depression and anxiety. They can deplete iodine, folate, and sodium. Iodine is essential for your thyroid health, and this regulates your metabolism. Then finally, we have NSAIDs. These are for pain and inflammation. Example, ibuprofen and aspirin. These deplete folate, vitamin C, and iron. And frequent use can lead to gut irritation, further hindering even more nutrient absorption. So the bottom line is that if you're taking any of these regularly, you don't necessarily need to stop the medication. But you do need a strategy to replenish what is being lost. So addressing these gaps can reduce the side effects of your prescription, and it will improve your overall results and improve your health. So if you'd like to check your current levels, or if you want to build a targeted replenishment plan, we can chat during your next visit. I'm Dr. Yates. I hope this was helpful. Bye.